Welcome to Get Real. Today we're going to talk about a very important topic that affects many children and their families. We're going to talk about impulsive behavior disorder, also known as IBD, and how it impacts children who are not medicated. First, let's talk about what IBD is. IBD is a condition that affects a child's ability to control their impulses. This means that a child may act without thinking, speak out of turn, or engage in risky behavior. These actions can negatively impact a child's relationships, academic performance, and overall well-being. Now, what happens to children when they aren't medicated? Children with IBD who are not medicated may struggle with maintaining relationships with peers and adults. They may struggle academically, as their inability to control their impulses can make it difficult for them to stay focused and complete tasks. Additionally, children with IBD may be more likely to engage in risky behaviors such as drug and alcohol use. It is important to note that when a child is first medicated for IBD, it can take 3 to 6 months for their brain to correct the chemical imbalance. During this time, a child may appear drugged or like a zombie. This can be concerning for parents, but it is important to stick with the medication plan as it can significantly improve a child's symptoms over time. Unfortunately, children with IBD are often victimized by school teachers and administrative staff. Their impulsivity can be misinterpreted as defiance or willfulness, when in fact their mind is wired differently. This can lead to punishment and discipline that is not effective and can negatively impact a child's self-esteem and confidence. Additionally, children with IBD may be bullied by other students, which can further damage their self-esteem and cause them to fall behind in their schoolwork. It is also important to note that IBD and ADHD often go hand in hand. Impulse control is often misinterpreted as defiance or willfulness when in fact the child's mind is wired differently. This means that even when a child knows they are not supposed to do something, their brain tells them it is okay to do it. So, what can parents do to help their child with IBD? There are several techniques that can be effective in teaching children self-control and helping them to overcome impulsive behavior disorders. First, it is important for parents to create a consistent and structured environment for their children. This can help to reduce their child's impulsivity by providing a sense of routine and predictability. Second, parents can work with their children to develop coping strategies for when they feel overwhelmed or triggered. This can include deep breathing exercises, meditation, or physical activity. Third, parents can teach their children social skills, such as how to initiate and maintain conversations, read social cues, and regulate emotions. This can help to improve their child's relationships with peers and adults. Fourth, parents can work with their child's school to develop a plan for managing their child's behavior in the classroom. This can include providing accommodations, such as preferential seating, and working with the teacher to develop strategies for addressing impulsivity. Finally, parents can seek out support from mental health professionals who specialize in treating children with IBD. A therapist can work with the child and parents to develop a treatment plan that is tailored to their specific needs. In conclusion, impulsive behavior disorder can have a significant impact on a child's life. When left untreated, it can lead to poor academic performance, damaged relationships, and risky behaviors. It is important for parents to understand the condition and work with their child to develop strategies for managing their impulsivity. Finally, parents can seek out support from mental health professionals who specialize in treating children with IBD. A therapist can work with the child and parents to develop a treatment plan that is tailored to their specific needs. In conclusion, impulsive behavior disorder can have a significant impact on a child's life. When left untreated, it can lead to poor academic performance, damaged relationships, and risky behaviors. It is important for parents to understand the condition and work with their children to develop strategies for managing their impulsivity. With the right support, children with IBD can learn to manage their impulsivity and improve their overall quality of life. It is important for parents to be patient and consistent in their approach to treating IBD, as it can take time for children to learn new coping strategies and for medication to take effect. In addition to the techniques I mentioned earlier, there are other interventions that can be helpful for children with IBD. For example, cognitive behavioral therapy, CBT, can help children learn to identify their negative thoughts and replace them with more positive ones. This can be especially helpful for children who struggle with low self-esteem or negative self-talk. Another intervention that can be helpful for children with IBD is parent management training, PMT. PMT is a type of therapy that teaches parents how to effectively manage their child's behavior. This can include setting clear expectations, using positive reinforcement, and providing consequences for negative behavior. It is also important for parents to take care of themselves when caring for a child with IBD. This can include seeking support from other parents who have children with similar conditions, practicing self-care, and taking breaks when needed. In conclusion, impulsive behavior disorder can be a challenging condition for children and their families. However, with the right support and interventions, children with IBD can learn to manage their impulsivity and lead happy, fulfilling lives. If you have concerns about your child's behavior, it is important to speak with a healthcare professional for guidance and support. If you liked my video, please like and subscribe for more great videos to help you be a great parent. As always, speak with your doctor to create a specific plan for you or your child, because this video cannot address your personal situation because everyone is different. I'm Michael Atencio, and this is Get Real.